Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon. Today, I want to provide an update on COVID-19 in our province over the long weekend. I would like to start by thanking Albertans for looking out for each other these last few days. We heard many positive reports of mask use and of people following the public health guidance that we've put into place. I am happy to report that more than 9,750 Albertans have now recovered from COVID-19. I'm also pleased to report that our most recent daily case numbers have declined slightly. Testing identified 97 new cases on Friday, July 31st, 67 on August 1st, 74 on August 2nd, and 65 on Monday, August 3rd. More than 34,000 tests have been conducted since Friday. Currently, 85 people are in hospital, including 23 in intensive care. Sadly, I must also report 5 additional deaths since Friday, including 3 at the Good Samaritan Southgate Care Centre. My sincere condolences go out to everyone who has lost a loved one to COVID-19, and to all those living in and working on this particular outbreak site, those who are dealing with this tragedy daily. I am continually mindful of the devastating impact that COVID-19 is having on families and communities in our province in many different ways. I know that many are concerned about the outbreak at the Good Samaritan Society Southgate. I am as well. It is now the most deadly outbreak that we have seen in this province, and health officials are doing everything possible to contain the spread. Unfortunately, this virus spreads rapidly in close contact. Many of the recent cases and deaths in this outbreak were exposed weeks ago. AHS is working closely with the operator, has deployed staff on site to provide extra assistance, and is meeting with leadership daily to ensure that all necessary steps are being taken. Health officials are doing everything possible to support those who've tested positive and to prevent others from being exposed. The facility is following the outbreak protocols that have worked successfully in other outbreaks, both in Alberta and across Canada. This includes making sure that all necessary staffing, infection prevention control, and outbreak management measures are in place. We will continue to keep Albertans informed as we work to manage this tragic situation. This outbreak underlines the importance of our collective efforts to slow the spread of COVID-19 and to protect the most vulnerable members of our community. Part of this protection requires continually evaluating our response efforts and using the best available evidence to update our approach when warranted. One example of this is this morning's announcement on updated recommendations on masks in schools. As we have discussed the return to schools this fall, I have heard a lot of questions from parents and teachers about the plan. One frequent question I receive is why we closed classes in the spring when there were fewer active cases, but are resuming in-person classes now. It is important to remember how far our understanding of COVID-19 has come. In March, we did not know much about this virus. We did not know how it spread among children, whether children were a high-risk group, and what sorts of locations or gatherings were major drivers of spread. We were forced to rely largely on our knowledge of how other viruses, like influenza, had spread in the past. With those illnesses, schools can act to amplify the spread of a virus in the community. Also, the March school closures were part of a broader restriction put in place as we fought to avoid the surge in cases that was seen in other countries and that could have left our health system overwhelmed. However, we now know much more about this virus. We know that the burden of COVID-19 is higher in adults and that younger children are less likely to transmit to each other, although transmission can still occur. Evidence in jurisdictions around the world suggests that schools do not appear to be a major driver of community spread. We also know that this virus has been with us for 5 months and will be here for many months to come. Closing schools has significant emotional, physical, and mental health impacts on kids, particularly those who are the most vulnerable. All of these facts have informed the guidance that I have provided to schools. Returning to school with precautions in place seeks to balance all the needs of our children. There is no one perfect way to respond to COVID-19. Each path has advantages and challenges. The most important thing is to continue to learn. I will continue to watch the emerging evidence and, as always, adapt my recommendations as needed in the days and weeks to come. As I said, there is no silver bullet that will make any setting completely risk-free, and no region or community that is free from the virus. However, today's data shows our collective power to take on COVID-19 and limit its spread. 2 weeks ago, I called our numbers a wake-up call. Today, we are starting to see the result of Albertans answering that challenge. The number of active cases has decreased by more than 200 since last week. There are now 1,191 active cases in the province, down from more than 1,400 on July 28th. Also, 9 regions in Alberta have now left the provincial watch list. We still have a long way to go, but these are encouraging signs. They remind us that we are not powerless in this fight, and that working together we can limit the spread across Alberta. It is now August 4th, just a few weeks from the end of summer and the start of fall. The choices we all make now will determine caseloads through late August and early September. It is within our control to get cases as low as possible for the fall, to support students returning to school and businesses that are returning to work. Now is the time to make the changes for your kids who want to be able to go back to school in the fall. Now is also the time to teach your children how to safely put on, wear, and take off a mask. Simple steps save lives and can slow the spread. Wash your hands, physically distance, wear a mask when you can't, and if you're even slightly sick, stay home and get tested. We need to act each day as though everyone we spend time with may have COVID-19, even if we're among loved ones and even if we feel healthy. This is the best way to protect the health, safety, and well-being of students, staff, families, and communities. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first question, please?
Thank you. Yes, the first question is from Brian Robinson, Global Calgary. Please go ahead.
Hey there. I'm just wondering, have Albertans responded well to the spike in numbers and the mask bylaw? Can we expect more consecutive days of dropping numbers?
That's my hope. As I mentioned, we have heard reports from communities across the province of people responding to the call to be serious about COVID restrictions, and I think that these dropping numbers are encouraging. But there is no easy path forward except to continue to follow those restrictions. So even though the numbers are dropping, this is not an indication that COVID is over. It's an indication that our hard work is paying off collectively, and we need to continue that hard work.
Operator, could you put through the next one, please?
Kevin Nimick, CTV Calgary.
Hi, Dr. Hinshaw. As the cases have dipped down, are we expecting a second wave when the weather starts to get less warm again in the fall? Is that what the models have predicted, where we have less cases when the weather's very warm and people are outside, and then more cases when people are back indoors?
We know that some viruses like influenza have that very marked seasonal pattern, so we see less cases in the summer, more cases in the fall. What we're seeing with COVID is less of that significant reduction, and I'll note that in places like Texas and Florida, where they do have warm weather, it's not resulting in the decrease that typically would be seen, for example, for something like influenza. So our numbers are really a reflection of our collective behavior. In the fall, it's possible as people start to spend more time inside and less time outside. Again, if we collectively start to ease off on our COVID precautions, it's possible we could see increased transmission, but that is not inevitable. Really, the numbers are all about how we interact with each other and our collective ability to minimize spread. So what we see in the fall really is up to all of us and the precautions that we take every day.
Operator, can you put through the next question, please?
Rick Bell, Calgary Sun.
Good afternoon, Doctor. Of late, especially today, you've been attacked on social media, and I know what that's all about, when it comes to your recent advice on school reopening. And I'd like to ask you bluntly, to answer this head on, how do you respond to those very loud critics, as I say on social media, who accuse you of somehow being a puppet of the government and somehow not telling us what you really think about the government's plans? Now, I'm not saying I agree with this. I'm saying this is what the critics say. And do you think such criticisms amplified on social media are actually helpful as Albertans try to deal with the struggles of this pandemic? Thanks.
Thank you for the question. What I would say is that I have children in school, I have nieces and nephews in school, I have friends and family members who teach or work in schools, and that I have a very strong interest not only in the safety and health of all Albertans, that's my job, and I take that very seriously, but I have many people who I personally love and care about who will be in schools in the fall. I have provided my best advice and recommendations with respect to school reentry, and the recommendations that I have made based on best evidence, as you heard this morning, have been accepted and supported. What I would say is that there really is no one perfect answer to schools, and I completely understand that people are concerned. There's a lot of anxiety because we haven't had school for many months. And going back to school in the fall will be our first personal experience with schooling in a COVID environment. And of course, there's going to be worries. And of course, we want our children and our teachers and staff to be safe. The important thing, though, is that if we focus only on COVID and if we only think about the COVID risk, then we miss the opportunity to support the overall health of our children. And we really need to balance, as I said earlier, all of the needs of our kids, not just the need to protect them from COVID. So there will be families who it's not the right thing for them to send their children back to school for either the child's health or for someone in the household's health. And there absolutely needs to be options to support those families so that they can make the right decision that's best for them. So what I would say is that the back to school plan provides what I think is the best balance for the entire population. And it also provides flexibility so that individuals can make the right choice for themselves and their family. And that the recommendations that I've made, as I said this morning, have been accepted and supported. And so ultimately, again, very important to have discussion about these topics. There is no one right way forward, and we all need to be engaged in the discussion. But from my personal perspective, the recommendations that I've made, again, are about returning with that balance of all the needs of our kids and keeping, of course, staff and teachers safe. But this is not black and white.
Operator, can you put through the next question, please?
Terry Reith, CBC.
Well, good afternoon, Dr. Hinshaw. Would you be able to outline for us the protocol, what should happen if a student or staff member or multiple students or staff members were to get sick in a school, and what would be the threshold to close a school?
With respect to the specifics of what would happen is it would be similar to any other case. So if there's a confirmed case in a teacher or staff member or a student, the first thing that would happen is an investigation to determine who that individual was in close contact with while they were infectious. And the important part, well, one important part of our back to school protocol is the fact that there's screening processes that happen every single day. So anyone who's feeling even slightly ill is going to need to stay home, get tested, and we're really trying to minimize the possibility that an individual would be in the school setting while infectious. However, if they had attended school during that period of time where they could have passed it to others, then anyone who they would have been in close contact with would be required to be at home for 14 days. And we would also offer testing to all those individuals who were close contacts of a confirmed case. With respect to what would happen if there were a number of cases, again, we would be looking at the spread. So if there were an individual case and then there were several more that happened in close contacts, but all of those close contacts were at home while they became ill, then there would be no further exposures in the school setting. So it's not just about the total number of cases, it's also about looking at ongoing exposure if that is present in the school. And when a school would close would really depend on the local situation, how many cases, how many exposures, is there exposure in multiple grades, is there exposure in key areas, and so it would be a discussion with the local principal, with the local medical officer of health, determining what the risks are. And of course, there's always going to be communication to parents. Whenever there is a confirmed case in the school, there would be proactive communication to parents about what's happening, without identifying, of course, the individual who has become ill. So one of the hallmarks, we are working on a protocol that will outline all of these steps that should be ready in the coming weeks. But one of the important things is, of course, transparency and ensuring that everyone understands what would happen with those cases and how the investigation would progress.
Operator, can you put through the next question, please?
Yes, Licia Corbella, Post Media.
Oh, hi. Good afternoon, Dr. Hinshaw. You mentioned in your opening statement and then again in your response to Rick Bell that school closures can have significant mental health impacts on children and youth. So I'm just wondering if you can elaborate on that a little bit. And I'm wondering if you have seen a spike at all of suicides or attempted suicides or mental health issues in youth and young adults as a result of this pandemic and, the social distancing and all the sort of maybe the loneliness, perhaps, that can come from that.
Thank you. It's a really important question, and I think the two parts. So first of all, the evidence around schools and mental health. What we know from the literature is that schools provide not just an educational environment, but they provide an environment for support, and that children who find themselves in difficult situations, perhaps homes where there's violence, homes where there's some instability or uncertainty, school can be a safe place for those children. And when there is no safe place to go, sometimes that does increase the risks of that challenging home environment. The second question about suicides and mental health issues, what we have seen with respect to suicides, we are working very closely with the Office of the Chief Medical Examiner. We do not have at this time finalized data. It can take several months for investigations to be completed, so we don't have finalized suicide data at this time. However, nothing that we're seeing in terms of the total numbers would indicate at this time that there has been a spike in suicides during the time of the closures. So again, that's to be confirmed as all of those investigations wind their way along and get finalized. To date, however, we're really wanting to have all of those considerations in place, not necessarily because we have seen a spike in those issues, but because we know that we need to avoid the escalation or exacerbation of some of those things that would make would become worse if we had prolonged school closures over the coming year.
Operator, can you put through the next question, please?
Yes, the next question is from Lisa Johnson, Post Media.
Good afternoon, Dr. Hinshaw. I'm wondering, you mentioned that AHS has provided staff on site at the Good Samaritan Southgate Care Center, is meeting with the facility leadership daily to deal with the outbreak. I'm wondering if in those discussions, daily asymptomatic testing is being considered, or if that's a possibility in the future.
I don't have the information on the frequency of asymptomatic testing that's happening in that facility, so that's something we could look into and get back to you on. I know that regular asymptomatic testing has been used in outbreak settings in terms of not just a one-time sweep, but when there is an ongoing outbreak, doing repeat testing. I just don't know the frequency of that, so we can take that away and get back to you.
Operator, can you put through the next one, please?
Madeline Smith, Calgary Herald.
Hi, Dr. Hinshaw. I was just wondering if you have any idea what to attribute the lower case count to. Obviously, there has been a lot more discussion about mask wearing in kind of recent days, but any mandates weren't in effect until quite recently. Have there been fewer gatherings that you've heard reported, or just less activity, people being more careful, or do you have anything specific to pin that to?
It's difficult to say if there's one particular thing that's causing the decreased numbers. So at the moment, what we do know is, again, that we've had reports from people in different parts of the province that they have been seeing over the last week or so an increase in people following guidance, an increase in mask wearing. As you say, that is relatively recent. It's the numbers, as you know, just came out today, so we haven't had a ton of time to dig into them yet. So really, right now, we're looking at the anecdotal reports, and I guess it's our hypothesis that one reason for these lower case numbers is that we have had a response from Albertans in general to follow more of the public health guidance than perhaps they were before, but we'll continue to look closely at these numbers and work with our local public health partners to see if we can identify what those key changes have been and make sure that we're continuing to enhance those measures that are working well and find the places where we're still having challenges and address those.
All right, we've got time for 3 more. Operator, could you put through the next question, please?
Yes, Andrea Han-Carr, CBC.
Hi, Dr. Hinshaw. First of all, could you please provide details on how you're containing COVID in the Remand Center after third positive test yesterday? And then in connection to this, I've spoken to inmates, lawyers, and read court rulings from judges who all say Edmonton Remand staff and inmates are violating the province's own protocols to prevent the spread of COVID, that there are no audits or compliance mechanisms in place. And that ranges from violations of physical distancing to PPE to inadequate cleaning supplies. And when I ask about this, I'm told about all the protocols, so I'm well aware of those, that they're on par with other provinces, and they're obviously working because there's been so few cases. But my question to you is this: shouldn't there be some compliance measures in jail, just like we have outside Remand with bylaws and fines, to ensure staff and inmates continue to remain safe?
The safety of people who are in correctional facilities, both inmates and staff, is of course as important as the safety of any other Albertan. With respect to the first question with the 3 cases, my understanding is that the most recent case that was identified as a part of the routine intake process where new admissions to the facility are quarantined and tested, and that they are not in close contact with the rest of the general population, and that this particular third case was identified as a part of that screening process. And again, as has been with the first 2 cases, the protocols are preventing transmission from occurring further within that facility. The second question, if I understand correctly, is about audits and compliance with respect to protocols in correctional facilities and whether or not that particular approach is needed in those facilities. We have worked with correctional facilities, both provincial and federal, to provide support for things like access to testing, as well as working on guidance and protocols for making sure that those who work there and who are inmates in those facilities are safe. It sounds like there are some issues that have been identified, which I can't comment on extensively, but I think that the question about audits, I haven't had an opportunity to consider that particular question, so I don't know that I can respond one way or another right now, but I will reinforce that the safety of those who live and work in these facilities is critical, and so that is something that I can take away. And I know our team has had some conversations with Justice and Solicitor General, and so we can take that away and have some more questions and discussion with them about that particular aspect.
All right, operator, could you put through the next question, please?
Eva Ferguson, Calgary Herald.
Yes, thank you, Dr. Hinshaw. I'm wondering if you can address the 3 positive COVID cases we saw confirmed late last week in the Calgary Catholic School District's summer school program, and whether that concerns you. Because considering that these summer class sizes were as low as 15, how might these cases be indicative of what could happen in the fall when we know classes will be much larger than 15, particularly in the big city school districts?
Thank you. And certainly, as I mentioned earlier, one of the critical parts of what we need to do is learn both from our own experiences and other jurisdictions. This particular case showed us a couple of places where we can improve. One is that we can do a better job when someone is symptomatic and comes for testing at ensuring that it's very clear that the person who's been tested does need to be in isolation until those results come back. And I think that particular instruction maybe hasn't been as clear as it needs to be in the past. So I will reiterate the call that if anyone feels even slightly ill, they do need to stay home, arrange for testing, and they do need to stay home until those test results are available. The second thing I think we've learned from this experience is that our wait times, our turnaround times from when a test is taken to when people get results. As I've mentioned before, we are working very hard on shortening that, but we know that when there is a delay between when someone goes for a test and when they get results back, unfortunately, sometimes there is an opportunity for transmission in that time period. So there are 2 specific opportunities for learning that we can take away from the particular incident that you referenced that I think, again, will help us make sure that we're doing everything we can to prevent transmission happening in a school setting.
All right, operator, could you put through the final question, please?
Thank you. The final question is from Rashmi Kumar, Radio 580.
Good afternoon, Dr. Hinshaw. And with the reopening of the schools, my question was, would AHS be working closely with the schools just in case there is a positive case? And what is the backup in place?
So the first question, yes, absolutely. Alberta Health Services will be working closely with schools and will be ready if there is even a symptomatic person who's been tested and the school has questions about what they should be doing. Alberta Health Services can help support those kinds of questions. The backup plan, I'm wondering, I don't know, do we still have the caller? The backup plan in case Alberta Health Services isn't available, or backup plan in case there's transmission?
Operator, could you patch her through if she's still on the line?
Yes, please go ahead.
So the backup plan in case of a transmission.
Okay. So with respect to, first of all, any particular case that's confirmed, we would be following protocols to make sure that anyone who was potentially exposed would need to stay home for 14 days to prevent the possibility of ongoing transmission in the school. And if we did identify transmission in the school, again, we would be continually working to put those rings around cases to make sure that those who are exposed are not in the school environment for 14 days to prevent onward spread. We have seen in other jurisdictions who've published reports of students who became positive with COVID before schools were shut down. So in places like Ireland or Australia, there's published case reports that indicate when an individual becomes positive, if they're not in the school, if they're taken out of the school when they're symptomatic and there's minimal time in the school when they're contagious. In those published reports, there was very limited, if any, ongoing transmission. And so again, I think it's really important to remember that no single part of our protocol will keep the school safe. It's all of these parts of the protocol together. So the backup plan really is what we do every day in public health, which is to let people know their test results, make sure that they know to stay home, and then work with those who are in close contact to have them stay home for that 14 days so that onward transmission is stopped.
Thank you all for joining us. Dr. Hinshaw will provide another update on Thursday afternoon.